Hello everyone. Welcome to sqadia.com. I am an educator, Dr. Lara M. Munir. Throughout this course, in our series of lectures on hematology, we started off by talking about the various types of anemias. Then we moved on discussing forward the thalassemias and the other related disorders. Then afterwards, we started talking about the myeloproliferative disorders. We discussed the various myeloproliferative disorders. And then later on, we moved towards the myelodysplastic syndromes. Now, as we all know, that dysplasia is a precursor lesion to leukemia or to malignancy in general. And in hematology, dysplasia can be considered a pre-malignant lesion to leukemias or lymphomas or the blood malignancies. So from today, we are going to talk about the malignancies concerning the hematology or the various types of leukemias and lymphomas. First, it is important to understand the difference between the two terms. What does the term leukemia mean and what does the term lymphoma mean? In a generalized term, and just for a matter of understanding, one can think of a leukemia is any malignancy arriving out of the bone marrow and going into the blood. For example, any cells that have started off in the bone marrow, any blood cells, specifically white blood cells, leukocytes, leukemia can be divided into the two terms. Leuke stands for white blood cells and emia stands for blood. So the malignancy of white blood cells, which starts off in the bone marrow and then the cells go into the blood. On the other hand, oma means a mass. So lymphoma generally means malignancy of the lymphoid variant of the stem cells. That are the B cells, the B lymphocytes and the T lymphocytes, and they generally present with a mass, a lymphoid mass. So that's why we use the term lymphoma for those cells. And for the myeloid lineage, which basically concerns the neutrophils, the granulocytes, which includes the neutrophils, monocytes, and basophils, we use the term leukemia, like the acute myeloblastic leukemia or the chronic myelogenous leukemia. These are the major terms that are used for the myeloid lineage, and for the lymphoid lineage, we can use the term lymphomas. So this is the generalized, of course, there are exceptions and there are overlaps. Some lymphomas can convert into the leukemia. Some leukemias can later on present as lymphomas as well. But for a matter of understanding and to have a good starting point, it is important to define these terms. Our topic of discussion today is acute myeloid leukemia. So as the term signifies, first just let's break it down into parts. The term says that it is an acute disease. So it generally presents in a very short period of time, in a matter of weeks or days. The presentation is very acute. So acute diseases I want to think of generally are related to the younger age or the younger population. When we are going to talk about the acute lymphoblastic leukemia, it is primarily a disease of the children. So the major age of presentation of acute lymphoblastic leukemia are from the newborn to about 14 to 15 years of age. And when we talk about the acute myeloid leukemia, it generally starts presenting around the 30s or 40s, and it can go onwards around 60s and 70s as well. If you just want to have a bracket in your mind, then it should be around 40 years of age to 60 years of age. That is the major age of presentation, but it can also present late in 60s and 70s as well. And similarly, it can also present early on around 20s to 30s. When we will be talking about the chronic leukemia, the chronic leukemias or chronic lymphomas, they generally present later on in the latter part of the age. For example, CLL, chronic lymphocytic leukemia, it is a very generally a disorder of the very elderly. Its median age of presentation is around 70 or 75 years of age. Similarly, CML also presents around the 40s later on in the 50s and 60s. So for just a matter of understanding, of course there are overlaps, but just for a matter of understanding and having a good starting point, acute generally means that it presents suddenly or it has a quick onset of, and then secondly, it is a younger age presentation. And myeloid generally signifies that it is concerned with the myeloid part of the hematopoietic stem cell. As we know that when the hematopoietic stem cell divides, it gives rise to the two branches, the myeloid lineage and the lymphoid lineage. So here we are concerned with the myeloid lineage. The myeloid lineage gives rise to the granulocytes. It starts off as myeloblasts, then later on moves as promyelocytes, myelocytes, and metamyelocytes, and then eventually they gives rise to the granulocytes, which includes the neutrophils, the monocytes, and the basophils. On the other hand, the lymphoblastic picture or the lymphoid lineage gives rise to the B and T lymphocytes. So here we are concerned with the myeloid lineage. So this disorder will involve generally the neutrophils, the basophils, and the mast cells. And it is a leukemia, so it's the malignancy of the white blood cells. So it is an acutely presenting myeloid cell leukemia, which generally presents in the younger population. So as you can see here in this picture, this is a granulocyte, which is which can be identified by the various granules present in the cytoplasm. When we will, in the next slide, I'm going to show you a mature neutrophil and the other granulocytes. So by that way, you can distinguish a mature cell from a blast cell. The term acute myeloid leukemia can also be used as acute myeloblastic leukemia because the disorder will have increased blast cells. It is basically an arrest in the earlier stages of development of myeloid lineage that gives rise to an increased number of blast cells. So we use the term acute myeloblastic leukemia or acute myeloid leukemia interchangeably. But acute myeloblastic leukemia is a good term to use because it gives us a good understanding of the disorder as well, that the disorder has the blast cells as the major cells which are present. Here, these big cells which you are seeing, these are basically the blast cells or the earlier stages of development of granulocytes. You can see that this is classified by a granulocytic nucleus, a granulocytic cytoplasm, and then there is an enlarged nucleus in the center which has some nucleoli as well. These fine granules, these are the ones which basically define the granulocytes. So this is the myeloblast cell. It can go on to become a monocyte, it can go on to become a neutrophil as well. So these are the cells which are abundant in acute myeloid leukemia or acute myeloblastic leukemia. They basically replace almost the whole of the bone marrow. The diagnostic cutoff point is that 20% of the bone marrow, greater than 20 or 20% of the bone marrow should have the myeloblast cells to have a diagnosis of acute myeloid leukemia. When we talked about myelodysplasia, we talked about that myelodysplasia is a precursor lesion to AML or acute myeloid leukemia. And in that, what was the cutoff point? We said that if the percentage of the blast cells in the bone marrow is less than 20%, then we define that as myelodysplasia, as it's a dysplastic lesion, it's a dysplastic condition which can progress onwards to the myeloid leukemia. And when that percentage crosses the 20% barrier, then we no longer classify it as myelodysplasia, we define it as acute myeloid leukemia. So that's an important thing to keep in mind, that AML, that myelodysplasia can be a precursor lesion to acute myeloid leukemia. The salient features of the disease is that it is a disorder of the white blood cells, which starts off in the bone marrow. It can go on and infiltrate into the blood. It can even go on into the lymphoid tissue, gives rise to the lymphoma, lymphoid tissue mass. It can also infiltrate other tissues. For example, it can go into the spleen and liver and cause hepatosplenomegaly. It can go into the brain and cause various types of neurological defects. It can go into the lungs and cause some pulmonary disorders, certain types of cough. So that is an important hallmark of a malignancy, that it can go on into all the parts of the body. It can metastasize to various parts of the body. Secondly, by definition, you can define it acute myeloid leukemia as a clonal proliferation of the myeloid blast cells. When we talk about the monoclonal proliferation, it signifies malignancy, that the only one cell, it basically goes wrong and gives rise to the large population of cells. Generally, in a normal person, the differentiation or the division of cells is polyclonal, where the cells divide and the further cells give rise to the various cells. But when we talk about the monoclonal differentiation, there is just one cell which has gone wrong, and it gives rise to a whole lineage or a set of cells that are basically the malignant cells that don't do their functions properly, and they cause harm to the body. And with increasing age, the incidence of AML increases, generally an age bracket of 40 to 60, 65. That is the age bracket of AML, but it can present on later on as well. The median age, you can say it's around 60 to 65 years of age. So this was a generalized introduction about AML. Now let's show you the various types of cells and give you an idea of how the cells divide and how they replace the normal cells. This is a normal person's, you can say, a bone marrow smear, which has the erythrocytes. These bilobe nucleus are the granulocytes. Again, these are the monocytes which have the horseshoe nucleus. It is easier to identify with the help of this picture. The red cells are the erythrocytes, which will give rise to the RBCs. These Multilobed nuclear granular cells are the neutrophils, and then these are the lymphocytes and the monocytes. The lymphocytes, as you can see, they have a very big nucleus which covers almost entire of the cytoplasm, and there are no granules in the cytoplasm. When we talk about the monocytes generally have a horseshoe type nucleus with a granular cytoplasm. And then there are also platelets. Platelets are generally not cells, they are the fragments of the megakaryocytes. So these are the cells which are generally present in a bone marrow smear. What happens in leukemia or acute myeloid leukemia, as you can see here, that this is in the normal person, there is a normal smear. You can see there was only one monocyte, and now the almost whole of this bone marrow smear has been replaced by these large monocytic cells. And the nuclei are generally larger as compared to the normal nucleus because they are in the earlier stages of development. They are the myeloblast cells. So this can be a presentation of the monocytic leukemia, which is a type of acute myeloid leukemia. The myeloid leukemias can cover the neutrophils and the monocytes as well. You can distinguish them on the basis of the shapes of their nucleus. We can also have the basophils, which have the bilobed nucleus, and they have a basophilic cytoplasm. So these are the major three cells that are going to be the most abundant when we are going to see the smear or the peripheral smear. This was a generalized introduction about the AML or the acute myeloid leukemia.